Member of Parliament, one Member of Parliament from Nakapipit, fellow Ugandans, members of the press, distinguished ladies and gentlemen. It's my pleasure to address you here today ahead of this year's World Day for Safety Health at Work 2026. On the 28th of April 2026, Uganda will once again join the rest of the world commemorate the World Day for Safety Health at Work under the theme Building Psychological Resilience, Sustaining Ugandan OSH Gains through Mental Well-Being and Organizational Strength. This important day provides us with an opportunity to reflect our progress in ensuring safe, healthy workplaces, while also renewing our commitment to addressing emerging challenges that affect workers across all sectors. This year's theme draws attention to crucial but often overlooked aspects of occupational safety and health, and also workers' mental well-being and psychological health. In recent years, Uganda has made a notable progress in strengthening occupational safety and health safety systems. We have enhanced regulatory frameworks, increased workplace inspections, expanded international interventions beyond the formal sector, and also awareness of prevention of occupational hazard. However, these gains can only be sustained if equal emphasis is placed on the psychological and also social well-being of workers, which can easily affect the individual health, business profitability, and also national productivity. The modern workplace is evolving rapidly, bringing with it new pressures such as the high workloads, job insecurity, long working hours, workplace harassment, and also impact of economic and technology changes. These factors contribute significantly to stress, anxiety, depression, and also reduce productivity if not properly managed. As government, we recognize that healthy workforce is the backbone of national development. Psychosocial resilience is not only about individual coping mechanisms, but also about creating support organizational environmental that workers feel valued, protected, and empowered. I therefore call upon all employers to 1. Integrate mental health and psychosocial risk management into workplace safety and healthy practices. 2. Promote a culture of openness, respect, and support within the organization. Provide access to counseling services and employees assistance programs. And lastly, ensure reasonable workloads and work-life balance for your employees. To the workers out there, I urge you to prioritize your mental well-being, seek support when needed, and also actively participate in workplace mental health programs. To our social partners, the workers and employers organizations, as well as our development partners, I encourage our continued collaboration and partnership in promoting awareness, research, and also implementing programs that address psychosocial risks at work. The government remains committed to strengthening institutional capacities, enforcing compliance with occupational health, safety and health standards, and promote policies that safeguard both the physical and mental well-being of all workers in this country. As I conclude, I want to thank you all, our partners, especially Enabel Uganda. They have supported us in planning for this event, and also urge you all to join us all in the planned commemoration of this event, which include, we have an event of a National Occupational Safety and Health Symposium taking place today on the 22nd of April 2026 at Nakawa Innovation Hub. A sanitation drive will be in Njeru, Nile Market. on the 24th of April 2026, and occupational safety and health run on Sunday 26th of April 2026, starting and also ending at the ministry headquarters. Let us come together to commemorate and continue to work together to build resilient workplace that address the nature, both physically and mental well-being, for organizational strength. I wish you all a meaningful and memorable commemoration of this important day as we celebrate in Uganda, and also prayerful remember those that have unfortunately been negatively affected as a result of work for God and my country.
Thank you.
Good morning, Minister. My name is Olivia Navagal. I have one. We were told to employers to integrate from workplaces. Thank you.
For our workers. Like in the Ministry of Gender, every Friday afternoon, we are not at work. Everybody is putting on something to go out. We do exercise, we put some music, we exercise together with our staff. Every Friday, if you come and visit the Ministry of Gender. And I really think all employers should learn to do this. Instead of only thinking on maximizing profit, they should be very thoughtful about the well-being and mental health of their workers by this. And you know, even just having that kind of exercise with your bosses and your team, it's team building. You develop confidence at workplace, and also able to interact with your workers and also know what they are going through. Someone can be able to disclose to you their grievances during that time, because it's I mean, you're trying to exercise, but trying to do something together with them. And then the other question, I didn't have a pen. The other question was about what we are doing. Mental health cases registered in the ministry. We have not yet registered in our department, but to be honest, there's a very big problem, because we know the funding that most of the organizations have been receiving from, for example, USAID. Many people lost jobs, and they're out there, and they need support. They need support mentally, they need counseling, because you know, it was just like, there's no job for you tomorrow. People were scaled down, they kept scaling down. In Karamoja alone, we have lost so many organizations have lost, and that means hundreds of children from Karamoja, for example, have lost jobs. In the refugee response, I used to monitor and supervise over 156 NGOs which were receiving funding from USAID, most of them, and most of the people have lost jobs. So I don't know what's going on at home, but at least those ones at organizational level, we have known, and we have also seen that Butabika has been giving us statistics that the numbers are increasing. That means it's a very big problem. And we, as the Ministry of Gender, we're trying as much as possible to be able to see how should we mitigate this challenge. And that's why we're bringing it right now, to make sure that it is part of the organizational mandates to have mental health activities, mental health and counseling within the workers at the organizations. And so, measures to strengthen workplace. More inspections, yes. I personally involve myself in inspections of these workplaces together with my team. We included mental health in our OSH amendment bill, and then we have been working also with all other MDAs as like the DPP on issues of mental health and so forth. James, I've talked about that. I think I've answered all the 3 questions. Any other question? There's someone here. Exercise, and then we're trained on how to use fire extinguishers. And also when you go to some hotels, you find when there are signs to show you that just in case of any fire, this is the area you should go to. But I mean, by the time someone notices that even the fire extinguisher is expired as an organization or as an employer, that means you don't really care. So we are urging most organizations, most employers or companies, to make sure that they train their people. Okay, they must be trained, and also they must have a staff who is designated on occupational health and safety activities in the organization. You know, sometimes organizations, I've gone personally to do inspection. You find that people are given gloves, they are given jackets, they are given boots, but someone decides to come in sandals. And then when you ask the employer, I've come for inspection, to look at your people, they don't have work. When they come and they ask them, were you given these protective gears? They say, we have. What happened? That they're at home. So we need each organization at least to have someone who is trained on this, so that they keep having it. Like when you come inside this building, for example, before even the director sees you in this building that you're not protected, there should be someone there at the gate to ensure. I went, for example, and I want to upload Toro Cement in Moroto. There's someone at the entrance, the new factory, even the factory of Sandbad. There's someone at the entrance who is ensuring that every worker, employee who is entering inside the factory is wearing a protected gear. This is what we should be doing, because human beings then, maybe I've washed my jacket, or I feel it's heavy, or, you know, when I was working in Karamoja almost 20 years ago, before our party, our government, that's the NRM, brought tranquility and peace in Karamoja. I worked with the United Nations, and we used to wear bulletproof jackets and bulletproof elements in Karamoja, and yet I was a Karamojan. But one day, someone decided to remove the element, and the bullet landed on his head. So it was very unfortunate, but if he had it, I don't think he was going to die, because by then, you know what was happening in the region. So let us take safety issues very seriously. Even you as an individual, when you're boarding a boda, I have a friend who moves with his element. He's not a boda, but he has it with him all the time. Please make sure you have an element with you for safety. At least you can fracture yourself and you stay alive, because self-protection is very, very important for you. And also, because sometimes you don't know what people are going through. You find a person walking, but the car is coming from the other direction, but the person did not look left and right because he has a lot of stress, mental issues, and they end up crashing. So,
Thank you very much.
you guys, this guy is supposed to be, were you a prefect? Is you MP? Okay, so we'll swear in together on the 13th, I'm sure. So, but for sure, the issue of occupational health and safety is very, very serious, and also issues of mental health. If I was an employer, I'm an administrator by profession. I also did procurement and logistics. But when I was working as an administrator in the hospital, I would take time to know what's happening with an employee. Where hasn't he come to work? Probably the person has a personal issues, and they cannot disclose to you as an employer. By the time I come to work, or you've sent me to the field, and I am not having food, my productivity is going to be very low, naturally. So I think I implore the employers to make sure that you facilitate these people right in front of me here very, very well. They eat well. One good thing, Uganda is very, very gifted by nature, that you can just stop your border and find something to eat on the street. You can even get binyewa, you know, even just sim. You can even get a Rolex on the street. That's a full meal. You'll be able to move. It's not like some countries where you have to go miles and kilometers. But so let's try, employers, NBS, NTV, all the radio stations, please make sure that these people right in front of us who are feeding this country with information and be given enough facilitation. But also safety measures. I'm going to talk with my team. We will be able to do inspections in some of these news and television companies, and see if, especially those ones who are inside, are protected, and when they're getting out, someone has to have something to show that I work for this company. And just in case of any problem, they identify me by the brand of the company that I'm going. Because sometimes they knock you. The other day, the other friend of ours who was knocked by the other van, it took time for people to know, but just because they knew his face, that which company he works for. So it is very important to make sure that our people are protected, and also we give them respect and dignity. Being a journalist is a professional, it's not just an employment, and so that we have them to support the country. Inspection, but when you insist, for example, we close down the company. We close down the organization. We have the mandate to do that as a ministry. So if you can also tip me and tell me I'm being mistreated here. Me, I'm a mother. I will come and question and inspect and close down the company, because I am given the mandate to do that as the Minister for Labour and out of the inspections are doing. So we have the mandate to do that. We have closed some factories, and we know, and we are moving. Because right now we are planning to have a very big meeting together with our labour inspectors at the districts, and also who are down there, to make sure that we have information about these organizations. Organizations that are employing people, no safety measures, no health related, no mental health, no support, no nothing, will be able to come now and bump into them and close them down. And also making sure that we have a reporting system on their computers. They report to us, and we'll be able to go and do an instant prompt kind of inspection in such organizations. But also just let us know when you have a problem. And that's what I'm telling to all employees who are out there, factory or in an organization. Once you have a mental related issues, get to us through our online, we have a free toll line in office, and we'll be able to send a team to come and give you support while you're working. So thank you. Labor, employment and industrial relations. Era tuzi wano olwaleero olunaku olwaleero okulangirira eggwanga nti tugenda kubeera n'olunaku lwaffe olw'abakozi, naye nga olw'abakozi okulaba nti abakozi bali bulungi, bali healthy, ate bali protected eri gye bakolera. Kubanga kino abantu oba omuntu oba talabiriddwa gy'akolera, kiba kitegeeza ne kampani oba gy'akolera oba tebakola bulungi. Olunaku lujja kubeera nga 28 guno omwezi gwennyini guno mwaka, tugenda kubeera nga tukola activities ezisinga, naye ekisinga tugenda kubeera mu Buganda. Tugenda kubeera tulina integrated mental health and healthy psychosocial management workshop. Tugenda kubeera ne workshop egenda kubeera tugenda kubeera promotinga emikolo eno wiiki yonna paka bwe tunatuukira ne wiiki eri bwe tunatuukira ku Labour Day, nga tupromotinga emirimu gyaffe eza occupational health and safety. Abakozi mukole nga mumanyi nti tulina kye bayita mental health, tusiikinge support eri organization bw'oba ofunyeyo obuzibu bwonna bwonna. Tosigala ng'osirikiridde n'ebizibu byo, oba ogende mu ddwaliro ofune support ng'ofunyeyo. Naye eno wiiki tugenda kubeera ne symposium nga 22 olwaleero. Tugenda kubeera Nakawa ku innovation hub, era bwe nva wano ngenda genda eri. Tugenda kubeera ne sanitation drive Enjeru Nile market nga 24 guno omwezi gwennyini, era ne Oshuran egenda kubeera ne Kampala ne offices zaffe. Naye olunaku lwa occupational health and safety egenda kubeera Mawagali SS Mbiko, that is in Mbiko district nga Lwakubiri 28. Era njagala kutegeeza eggwanga nti gino emikolo gigenda kubeera gigenda maaso ne ministry ey'agenda. Naye bwe tubeeredde wano, abaana batubuuziza ebibuuzo okulaba nti abakozi bonna ne bano abandi mu maaso ab'amawulire tusobole okubanga ba employers ne ba companies mulabirire abaana baffe babe nga basobola okutambula nga bali branded, nga bambadde bu jackets, bambadde kwegamba safety ekinabayamba ku mirimu gyabwe. Omuntu nga bwafuna ebizibu kiba kyangu nnyo okulaba nti omuntu amutegererawo ne branding gy'aba ayambadde. Then n'ekirala tulina okulaba nti abaana balya bulungi, kubanga omuntu bw'aba talidde mmere aba tasobola kukola. So oba oyagala emirimu gyo gigende mu maaso, gwe nga employer kakasa nti omukozi gw'okozesa alya bulungi, era embeera gy'akolera bulungi, environment nungi, n'ekizimbe ne office gy'akolera n'entambula eri nnungi nnyo. So awo kikutawaanya ku bwongo ate ng'oli ku mirimu. Kitegeera oyinza okubeera ng'okola nga tebakusasula bulungi, okola ng'abaana balwadde ate ng'olina okukola, bakama abo bakuyita olina okugenda ku mirimu ate ng'olina ebizibu. Kwegamba ofuna mental health, ebizibu biba bingi. oyinza okuba nga okola ate nga nawe kenyini towewulira bulungi nga naye nga baagala okole. Kwegamba ebintu bingi nnyo ebituluganya abantu ku mirimu gyabwe. So twagala kulaba nti buli organization nga ffe era twagiteeka mu act yaffe ku bili yaffe okulaba nti buli organization erinayo program mu organizations abaana gye bakolera eya mental health okubanga ne counseling mufuneyo omuntu asobola okuba nga counselinga abantu ku mirimu. Ekyo nakirabye ku organizations ezimu, nakirabye ku organizations endala naye ezisinga nnyo mu Uganda tutuziina. Twalabye ku mawulire abeebutabika bagambye nti mental health yeyongeddeyo era bagambye nti nga emyaka 2020 50 2040 enamba zigenda kweyongerayo. So tutandikirewo kati nga ffe bannayuganda abakozi baffe nga tubalabirira nnyo okulaba nti ebizibu bya mental health bye bagenda okufuna. Osobola nakuteebereza, osobola kutulaba omuntu alina mental health, omuntu agenda n'asirika ate nga abadde ayogera, omuntu agenda n'ajjako essimu ate nga abadde nga ku ssimu, omuntu abeera okwegamba abeera isolation natandika kwetuuza yekka ate nga abadde muntu w'abantu. Osobola naawe kutegeera omuntu aba atandise okufuna mental health. Tolinda muntu kugwa ddalu. Mental health kigamba nti omuntu aba agudde eddalu, nedda. Mental health oyinza okulaba omuntu ng'atambula olowooza mulamu naye nga obwongo bwo bwatabuka dda ate nga tali butabika. So tukalagane wamu nga gavumenti tulabe nti buli organization erinayo mental health programs abaana gye bakolera ne safety issues awali ne counseling. Thank you. Ffe enkigamya no mu luzungu twetegeka kugenda kukola physical health mu ministry yaffe. So nsaba nnyo nalakirabye nga n'aba OPM babadde bakikoze. Nsaba nnyo ministries, MDAs, bonna organizations, factories mufuneyo olunaku olumu abaana abakozi babeere nga basobola okukola exercise, mental health ne counseling. Mbeere ne sessions ezo buli organization. Tukimanyi bulungi nnyo nti ensonga egenda kubeera nsonga nnene nnyo era kijja ku affectinga emirimu gyaffe, kya affectinge n'abaana baffe kubanga bw'obeera unproductive ng'omuzadde n'abaana mu maka baba tebasobola okuba nga bagenda ku ssomero baba tebasobola ina long effect. So nga Ministry of Gender ffe twatandika dda okukola exercises buli Lwakutaano fena nammwe ab'amawulire mutandika okulaba mukolera wamu mukola exercises. Then measures fenga Ministry of Gender tukola inspections tutambula era nange mbadde ntambulanga n'abantu aba Oshbano department. Tugenda kujja eri gye mukolera kubanga kifunumye bulungi nti namwe muba mulina ebizibu ab'amawulire. Tugenda kujja mu organizations zammwe, employers bamwe tutegeragane nabo nti abaana abakola nabo bali protected, bafuna ekyemisana, bali bulungi, kwegamba balina ne mental health safety, balina counseling sessions. Kitwogera wano n'okulaba nti mwatandika okuba nga mukola exercises. So fena ng'eggwanga twagala kukola exercises buli Lwakutaano regular kubanga awo muntu abeera nga relaxinzizemu nga ino kati obwongo obugenda mu weekend. So tulabe nnyo nga bannayuganda nti tukolagana wamu tulabe abaana baffe nga basobola kukola. Ekyokusatu ekyo ndoza kyembala njagala bw'oba temufollowize amateeka aga gavumenti ge tuteekawo tujja ne tukola inspection ne tukuwa warning ate olumala bw'oba muganya okukolagana naffe okukola kye tugamba then we should be able to close down the company. Ffe nga ministry tulina mandate yo closing a company yonna noba okuba nga gwasinga okuba nga otuwa taxes mu ggwanga naye ensonga y'abantu baffe bannayuganda kyekikulu ennyo okulaba nti tubalabirira nga ministry eya gender oba nga gavumenti ya Uganda.